We all, want to have great relationships with our patients, but that it can be pretty hard. And if we can help people be more successful at that, I believe that our doctors and our nurses and our receptionists are going to feel better about coming to work.
How do we leverage those very strong clinician-nurse partnerships? How could we learn from the really top performers in our organization, see what they're doing, and then leverage that to other areas that are interested in improving but might not have the know-how to do that?
So Megan, my nurse, and I have been working together for about 2.5 years now, and the relationship is very good. I think there's two important elements to it. Communication is one, and the other one is chocolate. I think it keeps us both pretty well tied together.
We're busy, so we work hard, and we get a lot of work done. But at the same time, we have fun. We laugh a lot. I think patients see that. They feel comfortable. They feel more at ease.
She is fantastic, extremely intelligent, wonderful personality, and she's great with patients. And I think that sets up me for success by her setting the patient before I ever walk in the room. Does more than anything else I can ever do.
Sometimes I'll say, "Oh, I'm just the nurse," and he will say, "No, we're a team, and you are just as important." And I always joke about it, but really I do appreciate that he says that, because I really do think that he values my opinion. And
she anticipates what I need. I think I anticipate what she needs. So we try to sit down maybe every 6 months, probably now every year, during our slow time of the year, and say, what's wrong with the clinic? What's wrong with our day as it goes through, and where are there areas to improve?
And I think that, and sometimes actually patients come with family members and they're taking notes. So it really depends on how they're taking the information. If I see that they're struggling with my communication or my take on whatever's going on, I try to focus more on pictures or doing something in terms of writing. If I see that they're following my thoughts and my comments, I just let them actually write it down. I think that by them knowing what's going on makes them involved and makes them more compliant. And they understand what's going on.
So for me, I think the one thing I can say is AVS really helped me to change my practice. When whatever I'm telling, I have a dot phrase, so I can just put it in my AVS, so the patients have something to take home with them, which I think is always good, because in the clinic they don't know what they are listening. You have told them, but still I think when they have something concrete which they can refer to is always good. And I have also given my nurse's number there, and I have highlighted that, and I say, call us with any questions. So I think that also helps them.
So we talk a lot about why this work is important. And for me, there's a meta reason why. And that's because, plain and simple, it's part of delivering great health care. And so it's the right thing to do. Patients who are truly engaged in their care and feel confident of being able to talk and communicate and work with their caregivers are more likely to engage in self-management.
With different initiatives and whatnot, things can be kind of at the 20 to 30,000 foot level, and people conceptually understand it. But then taking it to more actionable items and showing people how you can make changes and influencing behaviors, I think people really appreciate having some tactical ideas about how to support their work with the patients.
The one thing to remember, it's not about the numbers, it's about the people.